Okay, so first of all, I feel disrespected because you're not even showing the questions I got right. Okay.
The question.
Okay, a patient has been one question I got right, and then you told me, and then it ended up being wrong.
No.
Nurse.
I gave you the rationale.
So when y'all get sick and y'all go to the hospital, just know the person that's gonna be working on you don't even know more than somebody who work at the damn post office.
Okay. Anyway,
a patient has been diagnosed with stage 1 Hodgkin's lymphoma. The nurse knows that which chemotherapy regimen, that's written wrong, which chemotherapy regimen is most likely to be prescribed for this patient. Okay. So these answers
I don't even know. You would have to actually know.
I have no clue what
this is a question where you would actually have to know what the treatment is, which I hate that they do questions like this because we're not doctors, so we're not gonna give them the treatment. Like, we don't just administer it. So for me to cycles. I'm gonna just go with this, child. I don't know.
It's 4 to
which one you want to go with?
Okay, 4 to 6 cycles.
So the answer is 2 to 4 cycles. The patient is favorable. So you would have to know about the hunch, which my teacher don't care about that. She said, I'm not teaching y'all medications.
And she be kind of confusing when she taught that.
Chris, you wasn't in the class. Don't try to make it seem like you was in the class. Okay, come on, read it.
When caring for a patient with metastatic cancer, the nurse notes a hemoglobin level of 8.7, whatever that is, and hematocrit of 26%. What associated clinical manifestations does the nurse anticipate observing? What the hell is this question? This ain't no Stay Forever True G. We done wrong that.
Okay, no, manifestation, basically.
What associated clinical manifestations? I mean, if we talk about that, I could just say, hey, you cured. Just keep saying it.
No, like what clinical, what will you see? What will happen? What will manifest from this disease?
From these. Patient with cancer, the nurse knows a hemoglobin level, and the hemoglobin is either too high or too low. What associated clinical manifestation does the nurse anticipate observing? Thirst, fatigue, headache, abdominal pain.
So in order for you to know this question, you will have to know these levels and what will happen for the patient if it's low, and what will happen for the patient if it's high.
I know what hemoglobin is, and I don't know what the second one is. If it's too low or too high, what would you?
Okay, let me give you a clue.
Pain? No.
Let me give you a clue.
Headache? No. Usually, from people in my family and stuff like that, usually the thing that they treat the most is always fatigue. So I choose fatigue. That's the thing they want to treat the most. They want to make sure you're not fatigued.
Go on, nurse.
God dang. Oh, my goodness. I should have went to nursing school. I should have went to nursing school. This shit is so easy, man. Golly. Give me 2 years, I'll be a goddamn doctor. Maybe I can start class now. Put me on the damn accelerator program.
You want to go to accelerated BSc program?
Even though the person is dead by the time I finish rationalizing this question.
You said manifestation.
Okay. The nurse is caring for a patient with Polycythemia vera. What is an important action for the nurse to initiate? Okay, caring for patient with poly. So poly is because poly is multiple. Because mono will be one. And so poly, so they're dealing with multiple themia something. Okay, so you're dealing with multiple themia something.
And we're talking about blood. All these questions are about blood.
Right. Okay.
So they're producing a lot of blood cells.
Encourage deep breathing and coughing. Assist with or perform phlebotomy at the bedside. Teach the patient how to maintain low activity lifestyle. Perform thorough and regularly scheduled neurologic assessments. The nurse care for a patient with phlebotomy at the bed. No, I don't think that's it. Teach the patient how to maintain. I don't think that's it.
I'm gonna just answer this.
Perform thorough and regularly scheduled. If you're dealing with that, I assume that the important action that you would want to do would be perform thorough and regularly scheduled neurologic assessments before you do anything, because you might not even be able to do anything. And encourage deep breathing and coughing. I mean, what that makes, I mean, I guess. assist or perform phlebotomy at the bedside. I don't even know what phlebotomy is.
Removing blood.
Teach the patient how to maintain a low activity lifestyle. When does that ever help? And I think it's D. I think it's D.
They do? Okay. I would think it's B. Only because I know this.
You know this question?
Yeah. Okay. I think with this one. With this, they're producing too much. So you have to actually like remove the blood because they're producing too much blood.
But if this is an ongoing disease, right?
I don't know if it's a disorder or a disease, because the disease, like you said, is chronic. If it's a disorder,
you want to do the... Okay, let's see.
Why am I even rationalizing with this man?
Dang it. You was right. Was you?
Yeah, I was. Perform that requires in order to reduce blood volume. Yeah, because they got too much blood circulating. So, yeah, if they had thrombose formation, then you would want to reduce that, because that means that they could be bleeding.
Okay.
So if they having too much bleeding, if their body is bleeding too much, you don't want them to be moving around too much, because what if they fall? Coughing and deep breathing it doesn't fit this. They're not typical manifestations of this disease process.
Okay. The nurse receives a provider's order. Okay, this is my
Oh God,
the nurse
Chris.
The nurse receives a provider's order to transfuse fresh frozen plasma to a patient with acute blood loss. Which procedure is most appropriate for infusing this blood product? Okay, so the nurse, she received an order to transfuse fresh plasma to a patient with blood loss. What procedure do you need to use when you want to infuse it?
Most appropriate.
Right. So that hang the fresh frozen plasma with the lactated ringer solution. Fresh frozen plasma must be given within 24 hours of thawing. Infuse the fresh frozen plasma at a rate of... Hang the fresh frozen plasma as a piggyback to a primary without KCI. Most appropriate for infusing. Okay, 24 hours. That's not a procedure. I mean, it is a procedure. It must be given. You would think that would be first, though, because if the fresh frozen plasma is not fresh, I mean, what's the point? Because if you didn't give it within the right time frame, it don't matter if you're hanging it, infusing it, using the dang on piggyback, whatever, using dang on lactated ringer solution. It wouldn't matter if the plasma is not good because you let it sit too long. So I think it's fresh frozen plasma within 24 hours.
Okay, let's see. Come on, Nurse Chris. It should be used within 24 hours of thawing to avoid a decrease in factors 5 and 8. Go on, brother.
Okay. Let's see this one. I mean, essentially I don't have to answer any because I can get these last 7 wrong. I will still pass the test, I believe. Before beginning a transfusion of packed red blood cells, which action by the nurse will be the highest priority to avoid an error during this procedure? Okay, so you doing the transfusion of red blood cells. So which action would be the highest priority to avoid? So which action do you want to avoid at all costs? Add the blood transfusion as a secondary line to the existing. Okay, stay with the patient for 60 minutes. Check the identifying information of the unit. Prime new primary V tubing with lactated ringer solution for 60 minutes after starting the transfusion. Okay, so I don't see why you would want to avoid that.
No. Read the question again.
Which action by the nurse will be highest priority to... Highest priority... Okay, I'm reading wrong. Highest priority to avoid an error. Okay, so if you're doing to avoid an error, you will want to stay with the patient for 60 minutes after starting the transfusion. That's what I would think. Well, no. Check the... Oh, yeah, of course. Of course. That's basic. Check the identifying information on the unit of blood against the patient's ID bracelet. That's it for sure.
Oh, go on, Nurse Chris.
I mean, you cut this video on thinking you was finna make me look like a fool. That's the problem.
I really did.
That's the problem.
I really did.
That's the problem.
Okay, yeah. Are y'all getting these answers right with him? Okay, the patient identity, that's basic. And you only supposed to be with them for 15 minutes afterward. I mean, you could be, of course, with them longer, but it's necessary for at least the first 15 minutes to be with them once you administer it. And then you would never hang blood with lactating You will always hang it with normal saline.
A patient with a diagnosis of hemophilia had a fall down an escalator earlier in the day and now has bleeding in the left knee joint. How are you falling down an escalator? Like, an escalator moves by itself, so how did you fall? Step on her and stay still. What should be the emergency nurse's immediate reaction? Okay, so he has hemophilia and then he has bleeding in the left knee joint.
Okay, so nurse's immediate action. What do you do first?
What should be the emergency?
So all of these are right. All of these are right answers.
Let me do it. I don't need you to talk me through it. I've been getting them right.
Okay, brother.
Okay. He fell down the... Okay.
You still on this escalator, Chad.
Yes. All right.
Like Tim Gunn.
Had to fall down the escalator, bleeding in the left knee joint. Okay, so if they bleed, hemophilia, obviously the blood, it's going to coagulate or is it going to do so? The blood's going to do something weird. What should be emergency nurse's immediate action? Immediate transfusion of, I can't even say that word. Resting the patient's knee to prevent hematorosis, assistance with, okay, range of motion, okay. If he's bleeding from the left knee, it's either, I don't think that wants an immediate transfusion. Because it's not saying like severe. I don't think it needs an injection, so it's between resting and range. I would think range of motion to prevent thrombus formation. Let me go with that one. To prevent the blood from doing something.
That's your final answer.
Yeah, that's what I picked. Dang it.
So resting, you don't want to.
I picked. It was either one. Either one.
You did. You was between those two. You was those two. Go on, brother. So it says clotting factors, not platelets or corticosteroids are administered. Thrombose formation is not a central concern in a patient with hemophilia. Patients with hemophilia, joint bleeding requires resting of the joint to prevent deformities.
The nurse knows that hemolytic anemia, so anemia, can be caused by which extrinsic factors? Okay, so extrinsic factors. Okay, anemia, trauma or splenic.
Okay, so it's no. Okay, never mind. You don't want me to talk about it, Chad.
Sequestration crisis, abnormal hemoglobin or enzyme deficiency. We're gonna try to pronounce
angiopathic.
Angiopathic, chronic diseases or medications and chemicals. Okay, the nurse knows that
it's hemolytic.
Okay. Abnormal hemoglobin. Anemia. Okay.
Want me to give you a hint?
No.
Oh, okay.
I'm finna pick one. Okay. Okay, chronic diseases. Or
yeah, which I answer, which I think the answer.
Abnormal hemoglobin or enzyme deficiency. Anemia is about deficiency. So, and then hemoglobin is okay. I'm gonna go with abnormal hemoglobin and enzyme deficiency.
Okay. So, I didn't know this answer. Leads
Girl,
to
if I didn't know it, I know you don't.
You knew for sure I didn't know it.
You tried it. You tried that one.
Questions like that.
A patient has been diagnosed with acute myelogenous leukemia. Okay. Leukemia. What should the nurse educate the patient that care will focus on? Okay, so you got leukemia. One chemotherapy patient waiting with active supportive care. Okay, well, if you got diagnosed with that, the thing that you want to do, I would think that you would be focusing on first is getting it into remission. That's it. Like, that would be number one. All these things probably go into attaining remission. So attaining remission probably requires you to do A, C, and D. So I'm going to go with B, attaining remission.
That's what they should focus on is the remission.
All right. We can go to the next one. We're done with these. The nurse notes a provider's order written at 10 a.m. for 2 units of red blood cells to be administered to a patient who is anemic. So you receive an order at 10 to give a patient blood who is anemic as a result of chronic blood loss. The transfusion is picked up at 11:30 a.m. The nurse should plan to hang the unit no later than what time?
So how long can these red blood cells be out?
The patient was anemic as a result of chronic blood loss. So you get it at 11:30. So the nurse should plan to hang the unit. So in between, we talked about that question earlier where you got to verify it with his bracelet. Then you got to probably do some little stuff. That stuff may take 15 minutes. I don't expect the whole process to take 30 minutes. I don't expect when you get it in at 10, if you got chronic blood loss, 12. I think that's late. So they go to 11:45. I think if you're moving if you're moving at a decent pace to verify everything, if everything is going right, you'll take about 10 minutes for that, 10 to 11 minutes for that, checking everything, letting them know what's going to happen. And then at those last couple minutes, 11:43, 11:44, you hanging it up. So I'm going to
Boy, it's not saying when you should hang it, but you should hang it no later than what time. So how long do you think these blood products last outside?
Well, if you can hang it by 11, okay, so you're right. So if you can hang it by 11:45, I feel like it should be. Then no later than noon. If you're not hanging it by noon, there's something going on. So I pick noon.
Why you say that?
Because that's 30 minutes. The person, I knew somebody with anemia before, like 30 minutes, like that's a long time.
Not how long, don't focus on is the nurse taking too long to hang it. Focus on how long you think it will take for this blood. Like how long is this useful, the blood? How long do you think the blood is useful for?
Okay.
Remember last time one of them was like you got to use a pack to thaw when it was within 24 hours. How long do you think red blood cells last for?
It don't say frozen. So it don't say frozen. So I think it's...
I remember I said when 3 of them is real close to each other.
Well, I don't want to do it like that. I mean, I actually know the medical answer for it.
Oh, okay.
I just gotta.
Okay. So he don't want to use any of the test-taking strategies.
I've been using test-taking strategies the whole time.
You right.
So I got it right.
You right, brother. You right, brother.
Was she like? Come on now. If she, let's see. If she take her lunch break.
If she take her, he or she.
He or she. Okay. It should be hung. I would think it should be hung by
no later than.
I mean, goodness gracious, it's 10 a.m. God damn.
No, that's when the order was written, but it was picked up at 11:30.
11:30.
That's where they try to catch you up at.
Dude still ain't got his damn blood yet. I would say 12:30.
So it can last for
I was thinking.
No, but I thought you could get it. You could last for 4. You can have it for 4 hours. Oh, no, it is 30 minutes. It is 30 minutes.
And I knew that. Wow, man. This ain't gonna get uploaded. I guarantee y'all this ain't gonna get uploaded. We can say anything on her, man. This is not gonna get uploaded, dude. I could say the fucking nuclear codes on this video right here.
Why is that gonna
Nobody
get uploaded?
ever know it. Because every question I've been wrong has been you leading me astray.
No, you said 11:45 at first.
That's crazy.
You said 15 minutes. Then you started talking about her lunch break.
That's crazy. Let's go to the next one.
Is it 30 minutes though? You have to hang it by 30 minutes. Where am I getting these 4 hours from? I thought you had 4 hours. What the hell am I thinking about with 4 hours? Well, that's why we do this. Is this food on my thing, Chris?
If y'all there, you know there wasn't nothing but the kids. Goodness gracious. You gotta need me in the St. Louis area. Just go ahead and start calling your family up and getting your affairs in order. Because
Nurse B can't treat you.
You ain't gonna make it. It's gonna be 3:30. She gonna be just hanging that damn blood bag.
So 30 minutes. It's only good for 30 minutes once you pick it up.
Okay.
Where did I get the 4 hours from, Chris?
I don't know. A patient with acute... I'm trying to move past it, I'm trying to move past it so you don't...
Okay, let's move past. Let's move on.
She in nursing school, y'all. She in nursing school, so she not,
she not
ain't treating nobody like this yet. Nobody with this stuff yet. She learning.
You're right. So I haven't. I've never hung blood. LPNs can't hang blood.
That's a heart, y'all. A patient with an acute peptic ulcer and major blood loss requires an immediate transfusion with packed blood cells. Okay, so you get an immediate transfusion. Which task is appropriate for the RN to delegate to unlicensed assistant personnel? Okay. So confirm that no. Obtain the vital signs before the transfusion. Okay. Monitor the patient for shortness of breath and back pain. Okay. Validate the patient identity and verify them. I would think that the thing they would want to assist unlicensed assistive personnel with is monitor the patient for shortness of breath and back pain. That would be the thing that I feel like you can leave to unlicensed assistive personnel, whatever that may include. So I'm pick that one. Go ahead.
You sure?
I'm positive.
Just think about it a little bit more. No, you know what? I ain't go after that last question. I ain't go.
Can you just pick it, please?
After that last one, I'm gonna leave you alone. I'm gonna let you answer your questions.
Yeah. Obtain the vital signs. I didn't know what all the vital signs included. I was thinking that, but it's like, why would the nurse sit there and monitor the patient for shortness of breath and back pain? Like, I can even do that. Because
that's considered an assessment. Only the nurse can assess what's going on with a patient. Because a CNA or unlicensed personnel might be like, oh, she breathing fine. Ain't nothing wrong, but the licensed nurse or the practical nurse or the RN would be like, no, look at how long it's taking her to take the next breath, or look at she's using different muscles.
So those are things that you learn. So is this patient unable to verbally?
You don't know. You can't read too much into it. You don't know.
Okay.
It could be any type of patient. You don't know.
All right.
So only nurses can assess. You can never delegate assessment.
That makes sense. Before starting a transfusion of packed red blood cells, the nurse would arrange for a peer to monitor their other assigned patients for how many minutes when the nurse begins the transfusion. Okay, so you're starting a transfusion. The nurse is arranging for somebody to monitor their other patients for how many minutes while the nurse begins the transfusion.
Oh, this was part of your other question.
Okay.
The rationale for it. That's why you got to read all your rationales.
So, the nurse would remain to monitor the patient. So, the last one was 30 minutes. But even if you allow for some time past 30 minutes, I don't think you would allow 30 minutes past. If it takes you 30 minutes to do it.
No, you have to hang it within 30 minutes of picking it up. Oh, I'm sorry.
She got all these questions wrong. Imagine getting all the questions wrong and trying to tell somebody how to do it. Goodness gracious, boy. I don't need Lewis's medical surgical nursing. If Lewis walk in here and try to talk to me, I'll listen.
Okay. I'll be quiet. Brother.
The nurse will arrange for monitor How many minutes? Okay, so it gotta be hung within 30 minutes. And then it's okay. I'm gonna go for an hour. No, I'm gonna go for 30 minutes.
Remember the other question?
How many minutes when the nurse begins?
Oh, never mind. I ain't supposed to say nothing.
How many minutes? Okay, so it gotta be It gotta be no less than 30 minutes.
Okay, what's your answer? The clock is ticking. You only got so much time.
30 minutes.
Wrong. You only got a minute. You gotta only stay with them for 15 minutes at first, and then you monitor them every 30 to 60 minutes.
Okay. I would say that's the first one I legitimately got wrong that I did.
Oh, legitimately?
Yeah. Without you.
What was the other one?
Trying to like.
What was I trying to do with the other ones?
The other ones I had the right answer. You was just telling me the wrong one.
You know what? Let's move on.
The nurse is assigned to care for several patients on a medical unit. Which patient should the nurse assess first?
Oh, okay. This one to get real.
Several patients on a medical unit. Okay, 60-year-old patient with a blood pressure of
Do you want to know the normal?
A 50-year-old patient with a respiratory rate of 26 breaths a minute and an elevated D dimer. 26 breaths per minute. That's a 40-year-old patient with a temperature of 100.8. And okay, so that temperature, that's not a fever. A 30-year-old patient with a pulse of 112 beats a minute with the blood. Okay.
Look at that temp again.
Okay. 100.8 is not a fever.
Okay.
It's not. Oh no. Yes, it is. I'm thinking 100.4 is what they can fix. So this is over a fever. So he got a fever. 26 breaths. Let me see.
You're not about to count your breaths in 1 minute, are you?
No, I'm not. But I ain't gonna be able to get 26 the way I was just breathing regular. So I'm gonna go 50-year-old respiratory rate with 26 breaths a minute. That's a lot. So I'm gonna go with the 50-year-old.
Just old 50-year-old. I don't know. Well, let's see.
Dang it. That's what I picked.
Yeah, and the correct answer is...
with the fever. With the fever. Oh,
yeah, they got an infection. And you don't know this, but neutrophil is your white blood cells.
Okay.
So their white blood cells is low on top of them having a fever, so they got some type of infection.
So what was the score? 13.
But you didn't do the whole thing though.
How many did?
Part of these we did. I don't remember. Because I think you started. When did you start doing them?
Let me see. Go up. Those first 3 wrongs in a row, that was you for sure. So I started at question 4.
I don't think you was that far up. I think I had already answered those.
Okay.
Wait, I don't know. Maybe you did start.
The blood bank. Yeah, I started at question 4.
You still got a lot of them wrong.
At the end, I started to kind of get a little mental fatigue, because I'm at school, I got the kids to take care of and everything. So I'm starting to think about other stuff towards the end of my test. And, I just didn't stay on track long enough. But I think she should let me, redo it, and she'll probably count the highest score. So I should be all right.
You think you'll be all right?
Yeah, I should be.
Okay, yeah. What y'all think? What y'all think?
13 to 28. Some of the people that's in nursing school right now that's watching this didn't get 13 out of 28. I guarantee you they didn't. So for y'all talking on this video, y'all tried it. Y'all didn't get no 13 out of 28. Some of y'all is jumping for joy if you get a damn 13 out of 20. Let me stop.
Yeah, leave these people alone.
Y'all making fun. No, I don't like people making fun of me, and I could just feel y'all doing it, so I don't like that. All right, y'all. Like, comment, and subscribe. Give Chris some encouragement in the comment section, y'all.